Module 1, Terminology and Back Anatomy. Types of joints. Here are the types of joints and an example of each. Gliding, you will find that in the carpal bones. As you move your wrist into flexion or extension, the carpal bones glide on each other. Ball and socket, you will find that at the shoulder and the hip. Ellipsoid, you will find that at the radial carpal joint, where the distal radius articulates with the proximal row of carpal bones. Hinge joint, just like a door at your house, you will find that in the elbow at the humeral ulnar joint. Saddle joint, you will find that in the thumb, in the hand at the first CMC joint, carpal metacarpal joint. And pivot joint, you will find that C1 on C2, which is atlas rotating on a stable axis. And you will also see that at the proximal radial ulnar joint at the elbow. The back and spine region can be divided into the cervical, thoracic, lumbar, sacral, and coccyx regions. There are 7 cervical vertebrae, 12 thoracic, 5 lumbar, 5 sacral, albeit fused into one bone, and 4 coccyx fused into one bone as well. That makes 33 vertebrae in total. Each vertebral region is unique, but they exhibit some common characteristics. Be able to identify the following vertebral structures. Let's start with the vertebral body. That's the large circular shaped part of the vertebrae, and it's the part that's in between the intervertebral discs. Next is the vertebral arch. It comprises all of the following prominences. Let's start right off the body. Right off the vertebral body, you will find the pedicle region. Then you will find the transverse process. Then you will find the lamina. And then finally, posteriorly, the spinous process region. Also, on the diagram, you will see the vertebral foramen, which is the canal where the spinal cord lives. One more thing to note is the transverse foramen. Anytime we hear the term foramen, it is an opening or a canal, and it's only in the cervical region where the vertebral artery travels. Muscles of the trunk and back can be divided into a superficial group, intermediate group, and a deep group. Do not get confused that the deep group can further be subdivided into a superficial and deep group. The superficial group of the spine consists of the trapezius, levator scapulae, rhomboid major and minor, and the latissimus dorsi. The function of the trapezius is varied since the muscle is large and has 3 portions: the upper, middle, and lower. The upper portion elevates the scapula or shrugs the shoulder, along with it can upwardly rotate the scapula when lifting the arm. The middle portion retracts the scapula since the fibers run mostly horizontal, while the lower trapezius portion upwardly rotates the scapula and depresses it as well. The trapezius is innervated by the cranial nerve 11. The intermediate group of the back only consists of the serratus posterior superior and inferior, a very thin, flat, serrated muscle that has little functional value. The deep group consists of the erector spinae group. They are the superficial deep back muscles. And the transversospinalis group, the deeper deep back group. The erector spinae consists of the iliocostalis, longissimus, and the spinalis. They are innervated by the dorsal rami of that region. In general, these muscles run vertically, so they function to extend the spine when contracting bilaterally, and side bend the spine when contracting unilaterally. The transversospinalis group consists of the multifidus, rotatories, and the semispinalis. Notice how these muscles travel diagonally from one vertebrae to another higher up. So they function to rotate the spine, and they help with spine extension when they are contracted bilaterally. These muscles also are present in the thoracic and lumbar regions as well. The rotator cuff group is also located on the trunk region, although they distally attach to the proximal humerus. The four members include the supraspinatus, infraspinatus, teres minor, and the subscapularis, the sits muscle. That's SITS. The supraspinatus contracts more with initiating lifting the arm. The infraspinatus and teres minor externally rotate the shoulder, while the subscapularis internally rotates the shoulder. Anteriorly, the chest muscles consist of the pectoralis minor and major. These two muscles protract the scapula and horizontally adduct the shoulder. From superficial to deep, the four abdominal muscles include the rectus abdominis, the external oblique, internal oblique, and transversus abdominis. The lateral trunk serves as the origination of the serratus anterior. The rib cage also has the intercostals, the muscles of respiration. A deep lateral or flank muscle is the quadratus lumborum. It connects the lower ribs to the pelvis, so it functions to elevate the pelvis, but can also be a source of pain. The blood supply starts and ends at the heart. Here, arteries leave the heart with oxygen-rich blood traveling to the rest of the body. Then the used blood returns through the venous system. The heart has four chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. There are also four heart valves between each one of these chambers. The tricuspid is first. Remember, you try before you buy. Then after the right ventricle, the pulmonary valve keeps the blood from reversing direction on its way to the lungs. Once oxygenated blood comes back from the lungs into the left atrium, the blood travels through the bicuspid or mitral valve on its way to the left ventricle. Finally, blood travels through the aortic valve just before it gets to the aorta. Make sense? Appreciate these structures of the heart: the aorta, superior vena cava, inferior vena cava, pulmonary artery, pulmonary vein. Appreciate on the posterior aspect of the body the cervical plexus, brachial plexus, spinal cord, lumbar plexus, sacral plexus, and the sciatic nerve. Nerve innervation to the back and trunk is accomplished through the peripheral nervous system. Once nerve roots leave the spinal cord, they are classified as the peripheral nervous system. The following is a cross-section of the spinal cord. Notice the following structures. Immediately coming off the spinal cord, you have the ventral root and the dorsal root. Ventral means anterior, and that root is motor only. The dorsal root comes posteriorly off the spinal cord, and it is only sensory. Notice those two come together very, very quickly, and where they come together is known as a spinal nerve. So a spinal nerve has its mixed sensory and motor. Continuing laterally, the spinal nerve splits into ventral ramus and dorsal ramus.